Myself, Dr. Sinny from the Department of Oral Medicine and Radiology. I will be speaking about HIV and AIDS, which is one of the very important topics when we are working in the clinics. So HIV, human immunodeficiency virus. The size of the virus is 1/10,000th of a millimeter in diameter. It is a protein capsule containing two short strands of genetic material made of RNA and enzymes. Two types of HIV are there, HIV-1 and HIV-2. The source of HIV infection is mostly either blood, semen or cerebrospinal fluid. Lower concentration of HIV had also been detected in the tears, saliva, breast milk, urine and cervical and vaginal secretions. To date, only blood and semen have been conclusively shown to transmit the virus. Pathogenesis of the HIV infection. HIV virus infects the CD4 helper T cells. Thereafter, uncoating and reverse transcription happens within these cells, uncoating of the virus and uncoating of the genetic material of the virus and reverse transcription forming the DNA from the RNA happens. Then this proviral DNA it leads to the formation of the virus and budding of these virus particles and cytopathic phase begins. Which are the host factors or the risk factors for HIV infection? Age. Most cases have occurred among the sexually active persons aged 20 to 49 years of age. Mostly it is seen in male than in females. However, in Africa, more females are affected, but in North America, Europe, Australia, about 51% of the cases are seen in homosexual or bisexual men. And in India, males are affected twice more than the females. So, risk groups are mostly the sex workers, clients of these sex workers, intravenous drug abusers, labor migrant, transport workers, partners of these labor migrants, street children which are coming into contact with every kind of the debris and the blood and saliva, military and police again coming in contact with the blood and other body fluids, healthcare workers coming in contact with every type of body fluid. Mode of transmission of HIV is most commonly during sexual contact, unprotected sex which can happen due to the oral, vaginal or anal sex, which leads to the 10 times more probability of the infection than in the natural route. Homosexuals and bisexuals are more prone to get infected. Transmission from the male to female is more as compared to female to male. It is almost twice as compared to the female to male. STDs facilitate the transmission of HIV, the sexually transmitted disease. If they are already, then it will facilitate the transmission further. HIV is transmitted through the infected blood by sharing needles, use of the contaminated needles and syringes, transfusion of the HIV infected blood or blood products. So these are the routes through which the blood can spread the infection. From mother to child, during pregnancy, during childbirth, during parturition, through the breastfeeding. So natural history of the HIV infection. After the infection, how it progresses through the human body. Okay. So first is the phase of seroconversion. After infection with the HIV, antibodies start developing, and this phase is known as the seroconversion till the HIV antibodies have not developed. Then after the development of the antibodies comes the phase of asymptomatic phase, where there is no sign of HIV infection. Immune system controls the virus production. Then symptomatic phase. Physical signs of the HIV infection are there and some immunosuppression is there as well. And then comes the full-fledged infection known as the AIDS. Opportunistic infections and end-stage disease happens in this phase. Severity of the illness is determined by the amount of the virus in the body and the degree of the immunosuppression or decreasing CD4 count. Higher the viral load, sooner the immunosuppression will occur. HIV attacks the WBC cells known as the CD4 helper cells. Over the period of time, opportunistic infections will occur and direct infection of the organs like the brain, HIV dementia, gut known as the GIT wasting, and heart infection known as the cardiomyopathy, and other complications and other organ system infections will happen. Now, incubation period. Incubation period is a period after the infection till the development of the symptoms. Current data suggests that the incubation period is uncertain and it spreads from somewhere few months to 10 years or even more than that, which is an asymptomatic phase. Now, there are 3 phases of the HIV infection. Phase 1, which spreads from 3 weeks to 12 weeks, up to 12 weeks maximum. Acute HIV syndrome or flu-like symptoms are there in this phase. After the infection, immediately after the infection, sore throat will be there, fever will be there, skin rash will be there, meningitis and fatigue will be there, which is almost similar to any normal viral infection. And HIV, high viremia will be there, which can be detected with the help of PCR and other direct tests. Now, symptoms are relatively non-specific. As I told you, it resembles the other viral infections. HIV antibody test remains often negative, but becomes positive within 3 to 6 months. This process is known as a seroconversion. Large amount of the HIV in the peripheral blood can be detected during this phase. Primary HIV can be diagnosed using the viral load titer assay or other test. Middle chronic phase, which spreads from 10 to 12 years, maximum 10 to 12 years. Primary HIV syndrome resolves itself, that I just described, and HIV infected person remains asymptomatic or has mild symptoms for a prolonged period of time, often years. Because the seroconversion has happened within a period of approximately 3 months, and after that period comes this middle chronic phase, which is asymptomatic. Competition between the HIV and host immune system is occurring during this phase, and the host is winning because the antibodies are developed and they are controlling the virus during the asymptomatic phase for a period of months or years. Then, as well as there is moderate viremia in this phase, which is lesser than the phase 1. Then comes the phase of full-blown AIDS. Severe immunosuppression is there during this phase. Drop in the CD4 count below the 200. Normal count of the CD4 cells is more than 950 CD4 cells. But in the phase 3, it drops below the 200 per microliter. So in this phase, high viremia will be there. Now, signs of the AIDS. What are the signs of the AIDS that can help us diagnose the disease? There are 2 types of signs, major and minor. So, for us to diagnose a patient as AIDS patient, we have to have 2 major and 1 minor sign. Major signs are the weight loss of more than 10% of the body weight, chronic diarrhea for more than 1 month duration, and prolonged fever for more than 1 month. So, any of the 2 signs should be there, either weight loss and diarrhea or weight loss and prolonged fever, or chronic diarrhea and prolonged fever. So, any permutation and combination of these, and 2 should be there. And 1 minor sign out of recurrent oropharyngeal candidiasis, persistent generalized lymphadenopathy, and persistent cough for more than 1 month, recurrent herpes zoster. Any one of these should be associated with the above major signs. So, there are multitude of the HIV complications which affect the pulmonary system, cardiovascular system, renal insufficiency, hypertension, atherosclerosis, vascular disease, pulmonary hypertension, pulmonary fibrosis, skeletal tissues and muscles are affected, leading to the osteoporosis or osteopenia, fractures, myopathy, sarcopenia. Malignancy can happen as well as the nervous system can get affected, leading to the cognitive dysfunction, neuropathy, GIT gets affected, leading to the diarrhea and multiple other complications, and endocrine system gets affected, leading to the vitamin D deficiency, thyroid disease, diabetes, reproductive system is getting affected, leading to the hypogonadism, and the metabolism is getting affected, leading to the hyperlipidemia and lactic acidosis. So all these multiple, like the hundreds of complications can happen once the phase 3 develops. So how do you diagnose it? In the laboratory, lab diagnosis. After we suspect the AIDS, direct test and indirect test. Two type of tests are there. In the direct test, we have ELISA, which is an enzyme-linked immunosorbent serologic assay, recombinant DNA techniques, viral isolation in culture, and PCR. So in this, we are either isolating the virus or its DNA or its antigen. Then in indirect test, we are doing the either CD4 count or lymphopenia is being detected, or the lymph node biopsy is done. So these are indirect tests. Prevention, raising awareness to not have the multiple sex partners, use of the condom during sex, as well as the IV drug abusers should be informed not to share the needle and syringes, distribution of the IC material, information, education, communication material, advertisement from different media or the channels to spread the awareness, prevention of the blood-borne HIV transmission through detecting the HIV-1 and HIV-2 while any person is donating the blood. People in high-risk groups should be urged to refrain from the donation of the blood, body organs, sperm or other tissues. Strict sterilization techniques should be followed in the hospital and the clinics, and avoid injections unless they are absolutely necessary. Rehabilitation of the HIV/AIDS cases. Antiretroviral treatment. Treatment for the HIV/AIDS. There are 3 types of drugs: nucleoside analog, protease inhibitors, and NNRT drugs. So, nucleoside analogues, zidovudin, didenosin, and jalcitabine and stavudin. These are not effective if used alone. These drugs slow the HIV growth only. Also, they prevent the transmission of HIV from the infected mother to the newborn. Protease inhibitors, ritonavir, indinavir, nelfinavir, amprenovir. These are more powerful than the previous nucleoside analogues, producing dramatic decrease in the HIV levels in the blood. This reduces the viral load, in turn enabling CD4 cell levels to skyrocket. Now NNRTI, non-nucleoside reverse transcriptase inhibitors. NNRTIs are available as nevirapine, delavirdin and efavirenz. These are the 3 NNRTIs available. These drugs bind directly to the reverse transcriptase, preventing the conversion of the RNA to the DNA, or the formation of the DNA is prevented. NNRTIs work best when used in combination with the nucleoside analogues, and the combination of the 3 drugs is known as the HART therapy, which is highly active antiretroviral therapy. Whenever we are treating a patient of the AIDS or HIV, and we ourselves detected it, or if the patient is already having the diagnosis with himself as well as is under the medications, then we have to write it on the card of the patient. We are not supposed to write the HIV or AIDS on the card of the patient, but we should write, which is non-ethical, we should write HART. If the patient is under medication, then we should write HART. Otherwise, we have to mention that patient is a suspected case or detected case of HIV or AIDS. Post-exposure prophylaxis treatment. Post-exposure prophylaxis should be started within hours of the infection or the exposure to the needle injury, when there is suspected chances of the infection of the HIV. It's for the accidental needle exposure to HIV among healthcare workers. It decreases the chance of being infected by nearly 80%, not 100%. So there are two types of drugrism, 2-drugrism and 3-drugrism. In the 2-drugrism, there are nucleoside analogues, zidovudin and lamivudin, and in 3-drugrism, it contains the protease inhibitor, either the lopinavir or the ritonavir also. Now, oral manifestations of the HIV. As per the revised classification of the oral manifestation of HIV in adults given by the AC Clearinghouse, London, there are 3 types of lesions, group 1, group 2, group 3. In the group 1 are the strongly associated lesions, in the group 2 are the less commonly associated, and the group 3 includes the least commonly associated lesions of the HIV. Right? So, in the group 1 lesions, it includes the candidiasis, is the most common infection in an HIV infected person, mostly pseudomembranous, or it can be erythematous also. Hairy leukoplakia, lateral hairy leukoplakia, which is bilateral, white colored papillary elevations on the sides of the tongue, is caused by the Epstein-Barr virus. Now, Kaposi's sarcoma, which is a malignancy, and non-Hodgkin's lymphoma, periodontal disease like linear gingival erythema, necrotizing gingivitis and necrotizing periodontitis. Group 2 lesions are the lesions less commonly associated with the HIV infection, like the bacterial infections, Mycobacterium avium intracellular and Mycobacterium tuberculosis. Then melanotic hyperpigmentation, necrotizing stomatitis, salivary gland diseases like dry mouth due to the decreased salivary rate, and unilateral bilateral swelling of the major salivary glands. Thrombocytopenic purpura, ulcerations not otherwise specified, because ulcerations are very non-specific in case of the AIDS patients. Viral infections, herpes simplex virus, HPV, or the varicella zoster virus. Now, group 3 lesions. Bacterial infections like Actinomyces israeli, E. coli, and Klebsiella pneumonia. Fungal infections other than candidiasis are the Cryptococcus neoformans, Geotrichum, Histoplasma capsulatum, Aspergillus flavus, and viral infections are the cytomegalovirus infection and molluscum contagiosum infection. So all these are the type of infections that we can see in the oral cavity of the patient and diagnose the patient if he might not be already diagnosed, and we can suspect HIV and get the test done accordingly, like for the HIV-1 and HIV-2 antibodies. We can get the patient tested, PCR we can get done, any of the direct and indirect tests according to the history of the patient we can go for, right. So this is one of the very important disease to be diagnosed or suspected whenever we are treating our patients in clinics, as well as to treat the patients, to get the patients treated whenever they are diagnosed with this, and to take the proper precautions. Okay, thank you.